Hello, everyone. Welcome to the Breathing Channel. This is Dr. Jennifer Hobson, and I'm here with a colleague of mine, Dr. Timothy Crowe from Dental Medicine Chicago. Dr. Crowe, hi there. Thank you so much for coming and being with us today.
Thank you for inviting me. It's a pleasure.
Dr. Crowe and I have been working for many years together. He is a dentist that works in the Loop in downtown Chicago at 30 North Michigan. And I'm here to interview him to share with my patients and with the public in general what is out there for patients that might benefit from cranial, it's called cranial dental medicine.
Dental cranial
Medicine. Sorry about that.
Yes.
So I wanted to share with you, Dr. Crowe and I have been working, I'm a physical therapist, he's the dentist. We've been working together for years, and I wanted him to describe the philosophy of this dental cranial medicine. Could you tell us a little bit of what that means, Dr. Crowe?
Thank you. Yes. Dental cranial is a marriage of cranial osteopathy and general dentistry. So dental cranial is diagnosis and manipulation. Dental cranial is diagnosis and treatment by manipulation. So we go beyond the typical dental exam to understand the basis for why a particular dental condition exists, the underlying cause of a dental condition. And we do this by feeling the head, feeling the muscles of the head and neck, balancing them out, and providing appliances of various kinds to support the manipulation to get the body and the jaws to work in a physiological, balanced nature, of which has tremendous impact on the rest of the body. The nervous system, the digestive system, the airway, and it's to balance out the body so that the body can live and function in a sustainable way with longevity.
So as a patient of yours myself, I understand the use of appliance therapy and would like you to describe how you use the ALF and other modified appliances to help reach our goals in helping these patients. How does this work? What are these appliances you're talking about?
Well, again, the appliances that we use, that I use, what they do is they support the manipulation that occurs of the masticatory system, of the jaws and the head. It supports the manipulation to get the nervous system and the function and the behavior of the patient to go in a positive direction, so that the growth and development and or the function of the jaws are such that there is less pain in the pain patient and that there's a positive growth and development in the child. You mentioned the word ALF appliance. ALF is referred to as an alternative light wire functional appliance. It's a light wire appliance that fits on the top of the upper teeth on the inside of the teeth. It's essentially invisible, and what it does is it supports the manipulation and supports the inherent physiological motion of the head, the cranial movement of the head. That appliance supports that. Not only does it support that, but it supports our adjustments as the physical therapist and or the osteopath and or the dental cranial operator up-regulates good normal function. These appliances support that when the patient's not in the office.
Now, someone like me who's a physical therapist and a myofunctional therapist, and also now doing cranial osteopathic manual medicine, the wire that I understand you've used with many of the patients and myself, it has a little omega loop right here behind the front teeth. And that's where our tongue should live and rest and swallow, and it actually allows the head to move properly.
Yes, absolutely. The wire acts as if it's almost like a tongue magnet, yeah, which it draws the tongue to the roof of the mouth. And when the tongue is at the roof of the mouth, the tongue and the peristaltic, the movement of the tongue and swallowing everything, stimulates the jaws, stimulates the face, stimulates the base of the cranium, stimulates the brain, stimulates the base of the cranium and the brain, so that this dynamic motion of the nervous system and the brain is upregulated, and it's just quite remarkable. That omega loop is a target for the tongue, and the tongue learns how to live up against that wire at rest, and it's just remarkable what the appliance does.
So that goes to my next question. You know, I know what kind of patients I refer to you for, but I'd like you to explain what types of patients would benefit from this type of treatment.
Well, the most obvious patient that benefits from this treatment are the patients that are in pain, and chronic head and neck pain, enigmatic dental pain. They benefit tremendously by these appliances, because routinely these patients have poor tongue posture, of which that's your province. The oral myofunctional, the movement of the tongue and how the tongue occupies the jaws is so very important for people to have a good airway, and for the nervous system to be so stimulated so that the patient's able to rest and relax and repair the body. And so that the pain patient is the most obvious patient. These are complex patients that have a variety of complicated needs that not only involves the oral myofunctional therapist and the physical therapist, the ear, nose, and throat, the neurologist potentially, or the orthopedist, or the osteopath. These are the most obvious patients that over the years have benefited most by dental cranial manipulation and appliance therapy, so that we can get these patients to be disengaged from their pain, so we can get the body pointed in a healthful, balanced, pain-free position. That soldered wire appliance, the ALF appliance, the functional jaw orthopedic appliances are so important and integral for that care to be successful.
Now, we're also leaving out one very important group. It's the mouth-breathing children, which, you know, children are so, you know, not using their bodies right, especially now that we're doing a lot more on computers, iPads, iPhones. Their postures are like this, and you know, slouched with. Yeah. You know what happens when you're slouched like this? Your tongue goes down, your jaw drops, opens, and goes back, and they're growing as in this structure. You know, for me, I love all my patients, but the children, I know I'm doing such a big service when we're restoring proper alignment and tongue posture and mandibular resting position. And these narrow-jawed patients, these children really need this type of treatment. And one of the reasons I really like using this type of appliance is because it's not too bulky in the mouth. The kid tends to be able to tolerate it. You adjust it so gently that it guides them, but it's not so forceful and directive. I think it's easy for these children to take it. Could you comment on that?
It is an orthopedic appliance. It's an osteopathic appliance. It works with the body, not against the body. And yeah, once these kids that have growth and development issues, the narrow jaws, the retruded jaw, the poor posture, the attention problems, the behavior problems, the poor performance in school, benefit tremendously by establishing a good oral rest posture and proper tongue position to open up the airway so the kids experience less chronic anxiety. And they benefit by this tremendously. But it's just not the appliance, it's the care providers, it's the oral myofunctional therapist, it's the physical therapist, it's the ear, nose, and throat, and also potentially the neurologist and the MD that have to be involved with this to support this as medically necessary for the kids to grow right and to prosper later as adults.
Right. Yes. Now, we've been working together for years and have even had study clubs in each other's practices. Yes. Where our therapists learn more about how to look at the body as a whole unit. Now, my practice is now basically a very holistic, full body approach where we look at the floor, the way people stand, how they walk, how their ankles, the arches are supporting their body as they move. Could you tell me how our office and your office, Renaissance Craniofacial Group, have worked together, and how? Let's try to share with the public, how does this work? You know, how do we work together? How do you see us working together, and how does it affect the patient's progression of care?
Well, the collaborative approach has a tremendous impact on the progression of care. A tremendous impact on that. The patients need to have a variety of inputs from their care providers. They need to be supported by the physical therapist, the oral myofunctional therapist, to learn the exercises and to become self-aware of what's going on. And in general, the dental office is not focused on that as much as they are on providing the appliances and the management of the dental condition. So to advance the patient's care, a collaborative approach between Renaissance Physical Therapy and Dr. Hobson and your group has had tremendous impact on these kids and their well-being. These kids are complex cases. It's growth and development. It's not solely my province as the dental cranial operator and the functional jaw orthopedist with these appliances to handle this stuff. I need support. The kids need support, and so the collaborative approach is the way to go. In the past, what's happened is that you're the gatekeeper for these things. Right? The physical therapist, the oral myofunctional therapist is the gatekeeper, and so you screen and see many patients, many more patients than I do, and those that are motivated, or the parents that are so motivated for whole body health and wellness, you see them and you get them over to me so I can do the structural work, so I can increase the size of the palate, increase the size of the arch, increase the size of the jaws, so as the jaws increase in size, posture's improved, airway is improved, the kids calm down, they're less prone towards attention deficit syndrome and or anxiety. And so it's very important. They typically, the mindset of the parent is not to go to the dentist for this stuff. typically the mindset of the patient and or of the parent is to go to the dentist to have teeth filled, and or have teeth straightened by a regular orthodontist, and their mindset is molded by the physical therapist and the oral myofunctional therapist. By having a relationship with Renaissance Physical Therapy or your group, the patients become more enlightened relative to their self-care. They take responsibility for their care and for their health. And so it's a catalyst towards this continuum of trying to develop a sustainable outcome of good health and balance for the rest of their life.
Yeah, I've learned a lot from you, Dr. Crowe, and the patients the adult patients, we'll talk adult for a moment. You know, we do a lot around posture and changing people's posture. Posture has been a big part of my practice for years. And now, well, the oral myofunctional therapy to try to restore and stabilize the head and the mandible in this proper posture. You know, what we do, we manually manipulate all these structures in the neck, the joints, the muscles, the lymphatic system, the breathing. But there's times that just physical therapy doesn't work, or just the oral myofunctional. So, and you know, children are more pliable, right? And you kind of grow with them, you guide their growth and development. But for adults that have had years of improper breathing mechanics and posture and all that, they take a little more effort to change and transform. But what I've noticed is certain patients that are the chronic pain patients that we have in our practice, TMJ patients and headache patients, you restore all of this and then their teeth don't fit in that posture that we're trying to correct.
That's a very common is that, so it's all in the bite. We you know, and head posture. So these patients have essentially grown into their malocclusions. These patients have, and they end up painted into a corner with a poor bite and a misaligned jaw, with a poor airway, with sleep apnea, with missing teeth, and so rather than just go ahead and replace the teeth, the best thing for these chronic patients, chronic pain patients and TMJ patients is to get with physical therapy and or with airway training, oral myofunctional therapy, to increase the oral volume, to get their metabolism and their function better balanced, so the dentist can get back in there and fix the teeth. The teeth can be fixed in a variety of ways, you know, through starting with ALF therapy or functional jaw orthopedics or splint appliance therapy. If the teeth don't fit after the body gets balanced out, then we have to supply the proper support, and that's with appliance therapy, a removable appliance. Some patients can live with the removable appliance their whole life. Some of these patients can discontinue the appliance and be just fine. Other patients need definitive work where the teeth have got to be so constructed and aligned by the dentist that's knowledgeable of this stuff, so that they don't have pain anymore and that they're able to get along on their own.
Right, right. There's one more aspect that I'd like to talk to you about, is the breathing clinics, the Hobson Institute breathing clinics. You know, you've taken the breathing clinic. You understand the concept of nose breathing first, and nose breathing means you have to have the proper tongue posture with lip seal and diaphragmatic breathing. That when we can restore that, these patients flourish. But you
Yes.
know, people tend to overlook breathing and think they're doing it just fine.
It's key.
The question here is, you know, how important is this
It's
this
so
breathing part, you know?
breathing, it's as important as eating. Okay, and so there's two things that sustain the body. It's the breath of life, the air, and the food that you put in your mouth. And that's it's so very important. Otherwise, you don't have life. And so very important. Years ago, I started looking at myself as a care provider and my ability to deal with patients in the chair. And routinely, I started to realize that patients are afraid of the dentist. They're phobic. They don't want to go to the dentist. They've had
Right.
bad experiences. And with learning more about breathing, Buteyko breathing, and cranial osteopathy, and how breathing affects the nervous system, and fight or flight and fear. Breathing's everything. You can't, if you have a patient that comes in, and if they're not breathing right, routinely, they're so fearful that you can talk to them and they don't hear anything you say.
Right.
And so we got to get the patients calmed down. Clinical hypnosis is a good way to get people to start breathing right, to becoming mindful of their bodies and of their airways and their anxiety, and Buteyko breathing or breathing exercises as you prescribe and train are so important to get that patient to settle down long enough so that they can make an appointment and get in here and sit in the chair and to get the structural work done by me or someone else that does dental, cranial, and functional jaw orthopedics. Breathing is everything. Eating is important too. You need teeth. And so you are what you eat.
You are what you eat, and eating too much and breathing too much is also a problem.
Also bad. That's correct.
People don't, the majority of my patients that I refer to you tend to be breathing 2 to 3 times the rate as normal. So I know that we all are a part of a team, because the patient, like you said, needs a multidisciplinary approach. Some need surgery, some don't. Some need a tongue tie release because their tongue's too tight in their mouth, and they need training afterwards to restore a proper tongue resting posture so that they're not clenched and tight around their face and neck.
Yes, we need to disengage improper breathing. We need to disengage improper oral posture. We need to disengage it. After you disengage those behaviors and those functions, the body will follow. There'll be more rest, repair, and recovery. Chronic pain patients get rid of their pain. Kids that are failing to thrive begin to thrive, and they get on a better growth trajectory. I mean, breathing and feeding oneself is so integral to life. I mean, it's so very obvious, but it's so overlooked.
Right.
And so that's what we do. We look at those things. We concentrate on those things. Disordered breathing doesn't necessarily happen with sleep apnea, but it happens all day long in some patients, in a lot of us, most people. I think that all the trouble that we've had on the streets of Chicago over the past week would be much less if some of these people learned how to breathe and relax.
Right, right. I agree. It's something that people don't really look at, and it affects their anxiety levels, their stress levels, their ability to concentrate, you know, all that.
Yeah, they don't feel safe.
Right.
If you don't have good breathing, you won't feel safe. And then on another note, this notion of balancing out heads and oral posture and breathing and good growth and development trajectories is so important for the full body and for the immune system to function properly. And so going forward, the next generation needs to have this kind of care so that they're better able to adapt to the future threats that they're going to have relative to overpopulation and the petri dish that we live in. And so we got to have a good immune system. And to do that, you got to have a good head on your shoulders, and you have to have a good masticatory system. The masticatory system, the viscranium, the lower part of the face, supports and nourishes the brain, and that's where all the decision-making processes occur. And so and the brain and the head, they run the rest of the body. And so this work is so very important. It's cutting edge relative to what else is being done out there in general dentistry or even specialized dentistry. This is a niche stuff that we're doing, and it's very exciting, and it's very beneficial to the whole family.
So I'm so glad that we had this conversation and we are now able to share this with others, because you have helped so many patients improve their health and their well-being and their lives in general.
We have.
Thank you.
We have. And you are a messenger, you are a gatekeeper, and it's my own personal professional development would not be what it is currently today without my relationship with you.
Oh, thank you, Dr. Crowe.
It's so true. It's so true.
Thank you so much.
And your group.
Great.
And so yes, we must continue on.
We will.
Damn the torpedoes.
That's right.
Right.
Well, thank you, Dr. Crowe, and thank you everyone for listening to the Breathing Channel here with Dr. Jennifer Hobson, and hope to see you again soon. Thank you so much.
Thank you.